I am an active 75-year-old. I have never smoked. But in the beginning of spring of 2025, my husband and my granddaughter noticed that my gait and my balance was really off. And my granddaughter kept on saying, "You got to use the cart, something's going on." And I just ignored it. And they also noticed I was driving the yellow line when I was driving my car. My emotions were kind of out of whack, and I was severely depressed. And the other thing that's kind of odd is I had a real heightened sense of smell. It was really weird. I could smell everything, it was super duper. And quickly the symptoms got worse, and it seemed like a matter of weeks. Actually, my husband says, "My goodness, I woke up overnight and I was like 20 years older." It progressed to a lot of pain in my left hand and my foot, which I attributed to a freak accident I had like in the spring earlier, and basically where a grocery bag caught onto my wedding ring and twisted my knuckle around and really damaged my hand. So I was dropping like everything. I think that was one of the most frustrating things of all, is dropping everything. And my left foot and my hand, so after I did the grocery bag, I dropped a tablet on my foot. That didn't help. Then it started, I got stuck in my clawfoot bathtub. I just couldn't get up. My kneecaps were really bad. I couldn't dress myself. I mean, my husband basically was taking care of me. I'd go for a walk to take pictures of the birds for a YouTube page that I do. I couldn't get off the field. I couldn't get up. And so my husband would come out with the dog looking for me. I'm going to shut this down just for now. 75-year-old. I have never smoked. But in the beginning of spring of 2025, my husband and my granddaughter noticed that my gait and my balance was really off. And my granddaughter kept on saying, "You got to use the cart, something's going on." And I just ignored it. And they also noticed I was driving the yellow line when I was driving my car. My emotions were kind of out of whack, and I was severely depressed. And the other thing that's kind of odd is I had a real heightened sense of smell. It was really weird. I could smell everything, it was super duper. And quickly the symptoms got worse, and it seemed like a matter of weeks. Actually, my husband says, "My goodness, I woke up overnight and I was like 20 years older." It progressed to a lot of pain in my left hand and my foot, which I attributed to a freak accident I had like in the spring earlier, and basically where a grocery bag caught onto my wedding ring and twisted my knuckle around and really damaged my hand. So I was dropping like everything. I think that was one of the most frustrating things of all, is dropping everything. And my left foot and my hand, so after I did the grocery bag, I dropped a tablet on my foot. That didn't help. Then it started, I got stuck in my clawfoot bathtub. I just couldn't get up. My kneecaps were really bad. I couldn't dress myself. I mean, my husband basically was taking care of me. I'd go for a walk to take pictures of the birds for a YouTube page that I do. I couldn't get off the field. I couldn't get up. And so my husband would come out look. So anyways, I had absolutely no confidence in my primary care physician. I went in there wobbling with a cane. I was heightened emotions, a little bit high. I had all this pain, and so she decided, well, with the pain, she'll send me to rehab on my hand and my leg, and then referred me to a psychiatric nurse saying she was going to look at the medications. Well, then she said, we'll review it in 4 months. Well, I would have been dead by that point. So, I mean, I just didn't really know what to do at that point. I had to do something. So I told my husband to go down to Express Care, which is a facility that tries to avert people from going directly to the hospital by, and if you can't get a hold of your doctor. So it's like in between place, and it's wonderful to have it nearby. I'm lucky to live in central Vermont. I went into the office crying, told the nurse that I thought I might have had Lyme disease. And luckily, she conducted a mini mental exam, which I was a little shocked about because my daughter kept saying, oh, you might have a stroke or something, which I know I didn't have. And I've been in mental health for years, so I kind of went, oh, geez. So she had us had me try and remember a couple of items, like a table and an apple and something else. And within 3 minutes later, she asked me, and I could not repeat the apple. I kept on teasing my husband and saying the apple must have fallen off the table. After that mini mental exam, that nurse told my husband to drive me to Central Vermont Hospital for an MRI, which I did immediately, and they discovered a very large tumor outside of the brain, pushing on the brain. The doctor actually said it was the biggest tumor he's ever seen. It was on the right side, pressing on the brain. And incidentally, they also found a small mass in the lower lung, which meant that it was malignant. And to boot, I did have Lyme disease. Next thing I knew, I'm headed to UVM because they were afraid I was going to have a huge seizure. I guess there's 85,000 people diagnosed in the U.S. annually. So, because it was malignant and it had moved from the lung, went up the lymph nodes to the brain, it was now a level 4 cancer, which, of course, we absolutely couldn't believe. I mean, oh my God, who would ever, we couldn't believe it. So before the surgery, when I was in the hospital, my left foot and my hand, I wouldn't let anybody touch it because there was such pain on the outside of that. The other freaking weird thing was they thought that the kneecaps, because it was on both the knees, and because the tumor was on the right side, it would affect the left side. So they thought that that was osteoporosis, which probably is. And the signals from this left hand were not going up into the brain. It was bizarre. That's why I was dropping everything. And I mean, it was just really weird. Things like one morning I woke up and I was crying at the hospital. I couldn't figure out what the heck was going on because it really hurt. And I told the nurse to look at the left side, and so she flipped me up like this, and underneath there was some dried macaroni and cheese from the night before, all my nighttime medications in a pen. It was bizarre. So they took me into surgery. It took 6 hours to remove the tumor. Then it was successfully removed. There was just 3 little blood vessels that they couldn't remove, which they're going to treat later with targeted radiology. The most bizarre thing of all is, so the next day, it's like I'm normal again. There was nothing wrong with me. No pain. I could actually move this hand that I couldn't move. I mean, like before, my husband would have to move my foot, like off the bed and all that, because the left-hand side of my foot wouldn't do what it was supposed to do. And I was in great spirits, actually, before and after. I mean, what are you going to do? I guess that's it for now. The only other thing I wanted to talk about good spirits. I don't know why I was so silly. I mean, what are you going to do? You can just move on with life. So when I'd go into the MRI, it starts out with these funny little noises, and then it gets really loud, like this. And all I could think of was just a couple of weeks before I went into the hospital, I watched this video where this news station invited people with their pets into the station, and this guy went in with this juvenile chimpanzee. Well, the chimpanzee was crazy, man, throwing things around, all their paperwork, and he was jumping on the tables. So every time I'd go into an MRI, I'd wait for that big knocking, because I felt like I just kept on making believe it was like this chimp on side. It was really funny. He's jumping on the Tell me when you're ready.
I'm ready.
Brooke, it's your lovely mother, Winston, taking a picture. I am already better. My hand and my foot used to kill me. I can actually touch them now. We're going to check my walking ability in a minute. I'm telling you, I am already better. It's amazing. I'm so happy. It's still a little funny here but I'm telling you, I can't wait to get home. And guess what? Seth is going to work with Kevin after he works on his land to build me a pond over there. Because he's got a big excavator for his land down there. But I just can't believe it. I'll make a bet my balance is a lot better. I cannot wait to go look at the flowers and hug Brandy. Poor little Brandy. I cannot believe you lifted him into the bathtub. He's heavy. And lifted him onto the bed. I will never believe it. That is hysterical.
Say hi to Brandy.
Wait a minute. They told me I'd cough a little because they put those things in your mouth. Hi, Brandy. I love you. Hi, Brandy. I'm coming home pretty soon. I'm going to give you a big old hug. I love you, Brandy. And Peaches, too. And I touch Peaches' nose. That's how I kiss Peaches. I just touch his nose. That's all I will touch. Don't remember, ignore him. Do not touch his head. Just touch his nose. And also Bella. That's how I kiss Bella. I touch the nose.
Okay. She's scooping out her brain
Is
or
that
something.
where it is?
Yeah. Yep. She's scooping out her brain, throwing it away. Okay.
Put the hair on there to cover it.
Ordered that for you, okay?
That's good.
I was able to get out of the hospital within 2 days. They said I was very strong. You know, I've always exercised. And they couldn't believe it. Was like all those symptoms were gone. So they let me go home. They even said, oh, when you're going to go home, you're going to need to build a wheelchair ramp and you're going to need a walk-in shower. My husband actually did build a wheelchair ramp, but I've never had to use it. The most difficult part after that is you have to, once you get out, is very stressful because you have to meet with everybody in the world, oncologists, lung clinics, treatment teams, radiology. Then I'm going to do chemo at some point, but not at this point. The funniest thing is, I'm headed for my first treatment after the tumor was taken out, and now they're going to do some targeted zapping or radiology today. And this is where I'm going to end this video. It's been quite a journey already, just organizing all the meetings and trying to figure out what's going on. I still have no idea when they're going to do target therapy on the lung nodules, but I'm assuming that's after the chemotherapy. But for now, I'll leave you with this. I'm still in good spirits. I'm doing great. I'm doing all the things that I did before that tumor grew. So we'll see. I'm in good spirits most of the time. I'm sleeping a lot, and I'm excited to have this done.